All right, so now let's talk about choosing a Medicare plan and what you need to know when you do so about both HSAs and FSAs. So to begin, an HSA is a health savings account. And the way that these plans work is if you're on a high deductible health plan, typically through your employer, you would have money that you would put into this HSA account pre-tax, and it can grow in there tax-free. You would then use those dollars for qualified medical expenses, and you could just go ahead and pay, before your deductible or any medical expenses throughout the year. Now, FSAs, on the other hand, these are called flexible spending accounts. And the way that these work is any money that you put into those accounts during the year, you have to spend all of that money during the year. So those aren't going to continue to grow and don't have all the tax benefits that the HSA do. So to be clear, FSAs have no impact on Medicare. HSAs, on the other hand, do. So let's talk about what you need to know about HSAs and Medicare and the timing of the two of them together. So I mentioned that HSAs and Medicare, there's a timing issue there. So two things that you need to know. Number one, so if you're taking Medicare right when you turn 65, you can continue to contribute to your HSA until right before you take your Medicare. There's no issue with that one. So the second situation is if you're working past 65. A lot of people take Medicare Part A when they turn 65, even if they're still working, since there's no additional cost and you pay taxes your whole life for it. But if you're on an HSA, you cannot have Part A. Or let me say that differently. If you have Part A, you can no longer contribute to your HSA. So let's say you continue to work for a few years after you turn 65 and you decide, I think I'm going to go on Medicare. Well, you need to stop contributing to your HSA 6 months before you enroll in Medicare Part A. And the reason for this is when you enroll in Medicare, they're going to look 6 months retroactively and have your Medicare start 6 months before. So those 6 months, you don't want to be contributing to your HSA if it's just going to go back anyway. So for example, let's say you want to apply for Medicare in July. You need to stop contributing to your HSA in January that year. So that way, when your Medicare starts, you'll be good to go. All right, now the thing to keep in mind with HSAs is there are some penalties involved if, two different routes that you can go. Number one is if you take your Social Security right at 65, you don't have to worry about this one because you'll stop contributing to your HSA. But let's say you work and continue to contribute to your HSA until you're 67 and choose to take Medicare at that point. If you're continuing to contribute to your HSA, there will be an excess contribution penalty. So essentially what they're saying is you are continuing to contribute when you weren't supposed to anymore, so you're going to be penalized for that. The other penalty associated with HSAs is if you choose to pull out your money out of your HSA and spend it on non-qualified expenses, so not healthcare expenses essentially, you will pay a tax penalty, and that is around 10%, and that'll be subject to income tax as well. So when we say non-qualified health expenses, that always gives us the question of, well, what is a qualified health expense? And the answer to that is typically things like your Part B premium, deductibles, co-pays, Part D drug premiums, as well as expenses. The one thing you cannot use your HSA dollars for is your Medicare Supplement premiums. So the bulk of the vast majority of other things that will come up throughout the year, you can use your HSA dollars for. It's just those Medicare supplement premiums that you cannot use your HSA dollars for. So one important thing to note is how spouses play into HSAs and Medicare. So let's say I go on Medicare now and my husband is not yet on Medicare. He can still contribute to our HSA. I can no longer contribute to our HSA, but both of us can use those dollars to pay for medical expenses. Now, when he eventually comes on to Medicare, he will have to stop contributing to the HSA at that point. But while we're waiting for that, we can still use the benefit of that HSA. So we always try to remind people, retirement is not a requirement when it comes to Medicare. A lot of people, if you turn 65 and continue to work, I'd really encourage you to continue to stay on top of how Medicare will eventually work with your employer plan, or how the timing of the two of them will work together, because situations like this 6 months does catch a lot of people off guard. So again, retirement is not a requirement for Medicare. So now let's talk about choosing the right Medicare plan. So this is incredibly important. We actually just had an example recently where a woman came into the office and she was in her late 70s and was spending over $400 per month for her Medicare Supplement and Part D drug plan. That's incredibly expensive. That would break pretty much anyone's budget. The plan really wasn't working for her the way that she wanted it to. So it's really important to continue to check your options, but let's go through what those options are. So what are these options? There's 3 different routes for the average person when they go on Medicare. First and foremost, Original Medicare. That's the red, white, and blue card that you receive from the government when you turn 65 or enroll in Medicare. And this is your Medicare Part A, which is your hospitalization, your skilled nursing care, some home health care, etc. Part B, on the other hand, that's the doctor side of things. So outpatient procedures, doctors, medical tests, etc. So this is, again, the red, white, and blue card you get from the government. And, typically most people, there's a deductible for Part A, and then generally what the government pays is 80-20. So you pay 20, the government pays 80%. Now, the thing to keep in mind here with Original Medicare is there's no cap on that 20%. So if you spend $200,000, you could be on the hook for $40,000. So most people choose to go kind of one of 2 different routes then to supplement their Original Medicare. So one route is a Medicare Supplement and the other is a Medicare Advantage. First, let's talk about the Medicare Supplement. So these plans are typically lettered. They're A through N. And if you buy, let's say a G as in goose, if you buy a G plan through Anthem, Aetna, Humana, any of the carriers, it's going to be the exact same G plan that you would get through any other insurance company. Now, the way that these plans typically work is you're paying a higher monthly premium, but you're paying maybe a small deductible and little to nothing in copays when you go to the doctor. So essentially, I like to say that if you're on a Medicare Supplement, you're paying in case you go to the doctor, or you're paying that upfront fee and very little after the fact. So one thing that I didn't mention on this is the medical side of things. That doesn't include the Part D drugs. You do need to purchase a Part D drug plan to pair with your Medicare Supplement. So, the pros of this are pretty much it's like a one-stop shop. You pay your premium and there's very little out of pocket throughout the year. The cons are this can get very expensive. A lot of people start on this option and after a few years, they realize they're paying a lot more than they're actually using the coverage. So there's certainly perks to both. Additionally, with the supplement, there are no networks. So anyone that accepts Medicare accepts your Medicare Supplement. Now, on the flip side of things is the Medicare Advantage plan. These, just forget everything I said about supplements. These work totally different. The way that these plans work is you would enroll in a Medicare Advantage plan with one of the big insurance companies. There are several hundred different plans available out there. And when you enroll in the plan, you get a book and you get to see all of the copays throughout the year. So let's say, you go to the doctor, you might pay $0 to $20 to go to a specialist or a primary care doc. And then there's a set dollar amount for everything you do throughout the year. You're in the hospital, you go to physical therapy, you're in an ambulance, etc. There's a dollar amount before you enroll in the plan. You'll know what that is. The way that these plans work is they are network-based, so you have to make sure that your doctor is in network and covered by the plan. And typically these plans are little to no monthly premium. So you might not be paying any premium, might be a 0 plan, for example, but every time you go to the doctor, those copays that I mentioned, you'll know what they are going in. So whereas the supplement you pay in case you use it, on the Advantage plan, you pay when you use it. Now, these plans do include your Part D. Most of them include your Part D drug plan as well. So it's just one plan for your medical coverage and your prescription coverage. And most of the time, these plans do include a couple other benefits, certain things that I'm not necessarily allowed to talk about, but things that are important for you as an individual. Now, the last thing that I do want to mention is how these plans work. People always say, how are they 0 premium? What's going on there? Well, the way that this works is the government will pay the insurance company to take care of you. And so it varies depending on where you live and different information. But the government's going to pay that insurance company each month to take care of you. So the government then says, I don't want to see bills. I don't want to see anything as we move forward. So you're then going to only deal with that insurance company. So when you go to the doctor, you're only going to show your Medicare Advantage card. And, throughout the year, these plans do have a maximum out of pocket. So your worst case scenario going in. So they work very different from the supplements, but they're definitely different routes for each person. And, sometimes we even see couples in that maybe they have different doctors they see, different prescriptions they take, different things going on in their medical situation. So maybe one ends up on one and one ends up on the other. It truly is based on your specific needs. So things that I would really recommend you keep in mind while identifying which plan you feel is right for you is, first and foremost, what are you more comfortable with? Would you rather spend more up front or more when you actually go to the doctor? Likewise, are there certain doctors or certain things that you absolutely feel strongly that you want access to? Or do you plan on spending your winter somewhere else? A lot of people spend their winters in Florida or Arizona or elsewhere, and they want to make sure that they have coverage there as well as they do where they live most of the time. So, the thing I really want you to keep in mind is this is complicated. There are literally hundreds of options. You could spend hours and hours and hours. In fact, I've seen engineers come in with spreadsheets where they outline all of this information and come to find out they missed one thing and spent all of that time for no reason. So there's people available to help. We've worked with over 50,000 people. We're here to help, but I would just highly recommend you find a trusted source to go through this process so you're not alone.